we are going to be presenting the con effect for legalizing physician-assisted death at the federal level. So I will give a brief introduction about what physician-assisted death is. It is the practice of allowing a chronically ill patient to end their life, usually through prescribed medication from a physician, doctor, health professional. There are two forms of physician-assisted death, and that is going to be physician-assisted suicide, which is when a patient self-administers the antibiotic prescribed medication and they do the life-ending treatment on their own terms. And then there is physician-assisted euthanasia, where a physician or a doctor will inject the medication into the patient's bloodstream, and then after a few hours the patient ultimately dies. So as of right now in the United States, physician-assisted death is a huge topic talked about among health professionals, regular everyday people like ourselves, the public. It has a little bit of support, but mainly it goes against many moral, ethical beliefs that a lot of people have, and they truly feel like this shouldn't be a practice that we should begin doing in the United States. They feel like it is morally wrong. Physicians feel like they should not have the right to end one's life, even if the patient is requesting it. So right now it is not legal at the federal level, but there is one state here in the US that has legalized it statewide, and that is Oregon. And there has been some fear from the public and health professionals that other states will follow in Oregon's footsteps, and that can increase the support for physician-assisted death. But ultimately, most people feel like it is ethically, morally wrong, and that it should not be legalized at the federal level.
Legalizing physician-assisted death raises serious concerns for citizens, the healthcare systems, and the medical professionals. While supporters tend to argue it gives individuals control over their end-of-life decisions, it directly conflicts with legal and ethical principles that prioritize the protection of life. U.S. laws uphold that every life has inherent value, and PAD challenges this by allowing doctors to facilitate death. Like, imagine a situation where a terminally ill patient feels pressure to choose PAD just because they don't want to burden their family financially. This could lead to decisions based on guilt rather than true autonomy. It also contradicts the Hippocratic Oath, which opposes physicians hastening death, potentially undermining public trust in medical professionals. Just like in Canada, where euthanasia laws have expanded so much that some people with non-terminal conditions, including mental health disorders, have been approved for assisted death, and that's a dangerous slope to be on. And then there's the financial side, the cost of regulating PAD, handling the lawsuits, and the potential shift away from palliative care, which can make it unsustainable for the healthcare systems. Like, if hospitals start seeing PAD as a cheaper alternative, funding for things like hospice care or pain management might decrease, and that could leave vulnerable patients with fewer options ultimately.
Not only is there an ethical, scientific argument, but there is an economic argument as well. And there are many reasons why we should not legalize physician-assisted dying on the federal level. Okay, regulatory requirements, added administrative costs as healthcare systems develop strict oversight frameworks for PAD practices. Additionally, the risk of litigation, higher insurance premiums, and legal fees could drive up overall healthcare costs, okay? These financial strains may outweigh any cost savings from reduced end-of-life care, potentially leading to inefficiencies in managing terminal illness. So overall, the economic impact of PAD legalization could place additional stress on the healthcare system that we don't need, okay? We don't need to have increased insurance premium costs, because not only will that limit or stop individuals from accessing healthcare, but many people won't have insurance. So this is one good reason why we should not allow physician assisted dying on the federal level, because it impacts the economy drastically.
Due to the ethical and legal emotional concerns, it should not be legalized at a federal level. Healthcare medicine is supposed to be about helping and healing people, and when it comes to that point where healthcare professionals do decide to help with physician-assisted deaths, it comes to a personal level that patients and families, their lives don't matter, and that they're more providing a straightforward and less costly option for hospice and not caring much about their pain and what they are going through. We should improve on working on end of the life and giving end of life care to make sure that all individuals feel that they are valued, their lives are valued, that we support that their pain management, access to support, and honor their final days. All individual lives do matter, and instead of normalizing physician-assisted deaths, we should start respecting and prioritizing and finding help for their terminal illness and giving them their last final days with their families and for themselves. Thanks.